Next, let's look at tongue position inside the mouth. You'll find this one under the oral posture section of your assessment form. If you don't have an assessment form yet, click the link below, enter your email address, and a full myofunctional therapy self-assessment form will be emailed to you so that you can follow along. So we already talked about lip seal. Next is tongue position. Ideally, we want the tongue on the palate. So you want your entire tongue slightly suctioned to the roof of your mouth, not so far forward that it's touching your teeth, but just behind your front teeth. And you want the whole tongue inside the palate, so you don't want any overlap here on the outside. And again, a slight suction so the outside rims of your teeth or of your tongue are more up and the center is a little bit more hollowed out. If your tongue was already there, that's great. Go ahead and write WNL within normal limits and move on to the next part of the assessment. If your tongue was not there, let's talk about the other options. You may have noticed that just the very tip of your tongue was at the roof of your mouth. Or potentially you noticed that your tongue was floating in space and it wasn't up at the maxilla or the upper jaw and it wasn't down on the mandible, your lower jaw. Another option was or is that your tongue is at the base or floor of your mouth. And then it's just kind of sitting down here, nowhere near the roof of your mouth. Again, ideally, we want the entire tongue, front to back, up to the roof of the mouth. Now, if you're assessing your infant, the infant who is not very mobile yet is much easier to assess with this one. You'll just peel their lips open and see what their tongue is doing. Ideally, you'll see a tongue that, again, is suctioned to the palate or the roof of the mouth. If you have a little bit older child, potentially 6 months when they start to get a little bit more mobile, all the way up to probably 3 or 4 years where they can't quite communicate to you what's going on inside their mouth. This age, it's going to be a little bit more difficult to assess where the tongue is, especially if they do have a really good lip seal. Now, if you can't get a full, great assessment of what's going on with their tongue, don't worry about it. We'll do as best as we can with this one, and then with other pieces of the assessment, we should be able to fill in some more information. If you have any questions as you do tongue palatal assessment test, please write some comments in the section below or reach out to me on my website, summerspt.com, in the contact form. I'd be happy to help.